I'm doing well. How are you?
I'm doing good, you know?
Good.
I'm so glad that you were willing to talk to me.
Oh my God, my pleasure. I'm so glad that you asked.
Yes. Now, have we met?
I don't know. Are you a grant recipient as well?
We are. We
Okay,
are.
nice. I don't know. I think we met in person.
You look familiar, but you're probably like me. You meet so many people, it's hard. It's hard to
Yes.
remember everyone.
And then when you go to all the events and I don't know.
Yes, but we've probably crossed paths because you have worked in the field now for what, close to 10 years?
Yeah, 10 years, like 10 years almost exactly. I've only been in Georgia though for 4.
Okay.
Yeah.
You were in Michigan, I think.
I got sober in Michigan, and that's where I start in Detroit, and that's where I started working. And then I went to grad school at Chapel Hill, and now I'm here.
Okay, great. Well, again, thank you so much for meeting with me. It's kind of a strange way that we got connected. So Kelly Geyser, she is she's now VP at Hazelden Betty Ford. So we have a partnership with Hazelden Betty Ford, and she was speaking to Commissioner Tanner, and he somehow this podcast came up, and he mentioned you as someone who has a great story to share.
Nice. I'm glad you
Yeah.
think so.
Yeah, so he's teed you up.
Cool. Right on.
Yeah, but before we do that, I'd love to hear kind of about your role at DBHDD. I actually watched Crisis of Substance.
Oh my God, I forgot about that. Yeah, that was my first job when I first got here.
Yes. What did
Yes.
you do? Because I saw that won an Emmy.
Okay.
Is that
Yes,
right?
it won a regional Emmy in the healthcare field against one other person, but it did win an Emmy
It won an
nonetheless.
Emmy. Yes, it won an Emmy. That's
Yes.
awesome.
Yeah, that was really, really random. So I started in prevention, which was I did prevention programming at UNC Chapel Hill. I also managed all their alcohol and other drug programs while I was there. And would advocate for students on the academic level and do kind of treatment, not really a real clinical treatment plan, but kind of a return to school. Here's all the things that I'm going to do to come back to school and be happy and healthy so that their academic department would agree to take them back. So then I moved here, and I started in prevention. So it was really just programs that went towards the prevention of substance use disorder. So a lot of like in school programs, community events, media campaigns. And then I went over to addictive diseases and I was doing treatment. So I was managing a number of clinical programs. And then by some God miracle, I got appointed this position. And this is much larger of a scope than anything I've ever managed. So this is about, I think you've probably heard, about $1.6 billion, currently managing 220 different programs. I really don't know. Well, really what happened is I was asked to tell my story at a board meeting because I have lived experience and I tried to be pretty open about that. And commissioner heard my story, and I can only imagine he talked to some people in the department, but also kind of hearing what I overcame interpersonally maybe made him believe that I could handle managing a really big project. And so here
Yeah.
I am. I really like it. It's really thrilling. I mean, it's really hard, it's really sad, it's really aggravating, it can be very confrontational. But right before I got on here, we were talking with these women down south coastal Georgia at Shane's Crib who are making tiny homes for women in rural areas with their children. And I don't know, like you just hear these stories from some organizations about what they're doing, and you're just like, I'm so grateful to be part of this, you know?
It is. It's absolutely amazing. And I wonder if, because some people who watch this may not know the history of abatement funding and kind of where all that came from. Could you speak to that? Just like what is this? Where does it come from?
Sure. So a lot of this started really kind of started coming into fruition many moons ago, many years ago, probably I don't know, I want to say 6, 7 plus years ago, a number of manufacturers, distributors of opioid settlements, Purdue Pharma is the one that's very commonly known,
Right.
were sued by all states who signed on to the lawsuit due to their role in the opioid epidemic. So that lawsuit took a number of years. Each state received a portion of that settlement, dependent upon the level of harm they experienced from the opioid epidemic.
Uh-huh.
And then we got those funds. Um, a lot of people may have heard of the tobacco settlement that happened many years prior. That settlement, particularly in Georgia, fell under a lot of scrutiny because very little, if any, of those funds were used for tobacco remediation.
Oh,
So,
wow.
yes, and so in order to kind of learn from our past mistakes, an MOU was created where these funds must be spent on opioid remediation. So I was, I think, maybe the first staff member I believe who was employed full time by the abatement was Melissa Malcolm. She was our attorney, and then I was the second. And so when I came in, there was really no infrastructure whatsoever, a lot of really great theories and ideas. And we were also at the beginning of our first application cycle. So it was really a massive whirlwind.
I bet.
Yes, it
Like
was.
pi- like piranhas, right? Just
Yes. And I had no idea what I was doing and had never worked quite on this scale. But I mean, pros and cons, we're constantly learning, we're constantly trying to implement better solutions and streamline this to the best of our ability. We're not perfect. Unfortunately, it is ran by humans, but I do think we're doing a good job of getting this money to people that need it.
well, just for your knowledge, you all have funded our immersion program, which I've been a part of now for 3 years, and it really changes lives. We have students that come in and learn about addiction and that have a real personal experience, and it's really meaningful. And I think Georgia, I mean, I would say is doing a good job, right? As far as all of the people that are trying to get people resources and because ultimately it's about, in my mind, it's about getting people to treatment, right? Getting
Hmm.
people help.
Hmm.
So thank you for everything that you're doing.
I feel really honored to do it. I feel really honored to be a part of this in any capacity. Obviously, I'm not from Georgia, so the fact that Georgia's kind of opened me with open arms to do this and the people that I get to talk to and like I think it's such a privilege. I feel very grateful. I don't think any thanks are deserved to me. I just feel very grateful to be part of this, like grateful to Commissioner Tanner for putting me in this. It's it's just such a testament to, I think, like recover. Like I would have never fathomed that this could be my life. Even like maybe 3 years ago when I was finishing grad school, I think that imposter syndrome you have as a person who used to use drugs the way that at least that I did, it was just so fast for me. Even still, like, and I've been in recovery for almost 10 years and I'm still just like, oh my God, they're gonna figure out who I really am one day. I'm gonna lose this job. I think it's just a constant thing.
I think a lot of people can relate to that. You know,
Hmm.
I think I can certainly identify with that as well. And
Yeah,
uh,
that's true. Up there
that,
at Emory,
yeah, yeah,
medical director at Emory.
yeah. Oh, I'm not a medical director
Oh,
now.
you're not? I'm sorry.
If
I thought your signature. I saw that you were.
I am it is confusing. I'm the director of medical and professional education
Okay,
at
well,
Emory.
that's still a big title.
It is. It is. I'm actually a therapist by trade. I'm a LCSW.
I am
Um,
very fascinated by counselors and therapists who, end up in these very high-ranking director management levels. I think it's such an interesting trajectory.
Taylor, I just run my mouth. That's it. That's all I do. And somehow it's kind of like you said, I have situated myself to where I get paid for it to
I
run
know.
my mouth.
It's remarkable.
And it's also it's fortuitous that I love what I'm talking about, right? And it's so meaningful, as you know. I think this line of work is hard. It can be it can really suck the life out of you, but it's also one of the few places where you see people change in such a dramatic way that it's like, wow, it's like a drug in and of itself. You want to keep, you want more of that, you know?
No, it really is. It really is. Hearing people laugh for the first time after getting sober is like worth millions of dollars to me. I just I can't describe it.
And so I'm really eager to hear kind of how you got here. You mentioned you have lived experience. Is that something that could you share a little bit of that?
Yeah, I can share as little, really, as like as much as little as you want. I'm pretty much, I try to be as much of an open book about it as possible because I think it's important. I also think talking about how low I've been and then, having these kind of like seemingly prestigious titles, it's important for me to say, but like I've also been down there. So I can really speak to how as much as you'd like.
Well, please. I mean, I would
Okay.
like to hear as much as you're willing to share.
Okay. Okay, fair enough. So I'm from Toledo, Ohio. I am the oldest of three. I grew up in a kind of a tumultuous family, I suppose. My dad had, for lack of a better word, like a spending problem. So it was
Mm,
very like feast or famine. Like there were periods where we have like lots of gifts and like they'd host these big parties, and then there were periods where we had virtually nothing at all, and my mom would be coming into the room being like, "What are we going to sell to pay these bills?" And it was really stressful. My mom really kind of resented having kids. I don't think that was the pathway that she would have taken if she thought she had another route to go. So there was a lot, I think a lot of her anger and frustration with my dad was geared towards me because he was so seldom around.
mm,
So she said a lot of things to me that were very hurtful and confusing as a child, even before using drugs. And it made me a really anxious child.
mm,
And because of that, I didn't necessarily excel in school. I didn't necessarily excel in sports. I'm like really physically awkward. Um, so I was constantly kind of looking for a space to fit in. And I think like the bad kids is kind of what I related to. I was told I was a bad kid by my mom all the time. So I kind of felt like this was my space. And I longed so much for like that kind of acceptance and friendship and any sort of, I didn't know that at the time, but I didn't have any sort of close relationship or loving relationship with my family. So I think I was constantly pining for that outside of it and really willing to do whatever it took to feel some level of acceptance.
mm,
So I started using drugs really young. I started experimenting with drugs probably when I was 11 or 12. I started using opiates at 14 and started using them intravenously at 16. I ended up leaving high school because of that at 16. And then by
mm,
18, I had two felonies. I was doing sex work by 16. I think I know that that is somewhat still a taboo thing to mention. Sex work, I think you don't hear that mentioned as often as it probably is prevalent.
mm,
Um, but I like to mention it because it's part of my story that probably has affected me the most, and I have had
mm,
to unravel the most since getting sober. That relationship with men in my body and money.
mm,
Is something I think will probably struggle with for the rest of my life. That the impact on that component of my use alone.
mm.
So at 18, I got my second felony charge, and my parents just didn't really know what to do with me. I was just a mess, and I was stealing from them and everybody around, living very risky life. And so I was actually sent out to California to a treatment center that I guess accepted our insurance and had my probation transferred out there. And so at what was it, 19, I was living in California. I had no money. It was a huge culture shock for me coming out of a small city in Ohio. And I tried to stay sober. I was failing. I was violating my probation a lot. And eventually I was sent to another treatment center in San Diego after kind of rolling around the inland empire for a while. And while I was at that treatment center, the man who owned it took a great deal of interest in me. He was like in his 50s. He owned it with his wife. took a great deal of interest in me, and then pretty much was making me do whatever sexual favors he wanted, kind of under the guise of like, well, I'm reporting to your PO, it's your word against
Oh,
mine.
ah,
I also think this is really important. When I was in San Diego, in that treatment center, I had a place to live. I had friends. I had food. I was sober. It was beautiful there. And so, if you were to have asked me at that time if I was happy, I would have said yes, and I would have been honest.
mm,
I felt like I was really fortunate to be in this situation because on the streets, I was doing the same thing for far less gain.
right.
Um, and I really thought I was so lucky that this was happening to me.
Wow.
And that's just like how warped my perspective was.
Right.
Um,
Right.
and eventually, I think I told another girl, and she started crying, and I was so pissed that she started crying. I just thought it was so ridiculous. I thought she didn't get it. And she went and told like the counselors and this man's wife, and they actually asked me to
Oh,
leave.
yeah.
Yeah, they asked me to leave, and I was actually approached by a group of attorneys who had represented the victims of the Catholic school, the Catholic priesthood in Boston. They approached me and they wanted to take on this very big lawsuit against this treatment center. And a number of other women joined this lawsuit with me, but I just had no idea what I was getting myself into at that age. I still really believed in like the idea of fairness and like bad gets bad, good prevails, which I do still believe that to some sense, but I guess maybe in a less naive context. So I ended
Mm,
up in this lawsuit for 2 years. And I lost all my friends. People hated me. I would go to AA meetings and people would like key my car while I was in the meeting. And people,
what?
well, this is before Me Too. This is before like people came out about Bill Cosby. This is really before this was a prevalent thing that people saw in the world. And to
Mm,
the defense of these girls, they felt that I was threatening the sanctity that they had found through this treatment center that did exist. And even though many of them were being sexualized, it was still a better alternative to what was there on the streets for them.
I
So they
see.
were just protecting what they knew. And I don't really place a lot of blame on them. And there was also, I think, a lot of things being kind of passed around about me and who I was and what I was doing. Um, but it was really hard for me to stay sober. I was really, really isolated. And I was out in California. I didn't have any family. Um, Eventually, though, the lawsuit did settle. However, it settled when I had relapse and I was back out on the street. And I went to Ohio again because my probation had ended. I guess I thought I could kind of get it together there. And I didn't. And I ended up getting shipped out to a treatment center in Michigan. And it settled while I was at that treatment center. And so, I was in treatment and I literally have to like leave group and go talk to these like lawyers about all this money and blah, blah, blah. But my dad convinced me that we should put it in a joint account that he would manage and that he would invest for me. That maybe not, of course, but that didn't happen. My dad actually ended up spending all that money within a year of me receiving it.
What?
And yeah, it sucked. It really sucked. It was a lot of money that would have substantially changed my life and my financial situation that I am currently in today, 10 years later.
Wow.
Um, but it is what it is. I mean, I guess in all honesty, I stole a lot of money. I caused him a lot of harm, and I suppose there's a level of equity in all that.
Mm,
But yeah, so I got out of treatment, a normal person, 22, trying to figure out what was going on. I had no ID, I had no birth certificate, I had no security card, I had nothing. I got a job washing dishes at a deli because I wasn't allowed to touch the cash register, and got my GED. And then I just started going to community college, and I got a lot of the first kind of like piece of good feedback I got, that lawsuit I was going through. I started using kind of sporadically in the middle of that. And I remember one day I came to a meeting that we were having and I was high and I was like throwing up and being a mess. And I had no ride home. And so I was sitting outside with this lawyer trying to like get a taxi. And it was the lawyer of this major law firm that had, won millions and millions of dollars representing victims of like sexual abuse. And we were standing outside, just me and him, and he was so annoyed with me and just kind of over me in general. And he just looked at me and he was like, you could do exactly what I do. I've had conversations with you. You could do literally exactly what I do. You could stand exactly where I'm standing, but you're choosing to do this. This is what you're choosing to do with your life. And I just didn't have much to say, but I never, ever, ever forgot it because that was the first time in my life someone who had accumulated that much success was like, you're smart. You could do literally what I'm doing. And I had just never gotten that kind of feedback in my life. So I'll never forget it. And then so fast forward, I start community college. I'm the entire time I'm just like, oh, I'll never be able to accumulate anything. It just seemed so beyond me. So I was like rapidly in school and I was constantly taking classes. I was constantly taking as much as I could because the idea of a degree was just like absolutely inconceivable. It's a bachelor's degree. And so somehow through all that, I ended up with 2 degrees because I was taking classes all through the summer. So I had a bachelor's in economics and a bachelor's in political science. And I hadn't really, again, like I worked at nonprofits. I was working in reentry in Detroit. I was working at some fancy restaurants and I think for whatever reason, I just wanted to prove to myself I could do something like big. So I wanted to apply to like really, really good grad schools. That was always a big dream, like bucket list thing of mine is I want to go to a really good school. Like that just sounds so beyond anything that I'm capable of. So I started applying to all these schools, so many schools, because I just could not, I just didn't think any would let me in, like not a single one. So I applied probably like 25 schools. I spent so much money. Um,
Wow.
I know. And at the time, UNC was number 2 for public health, number 1 for like a public school in public health. And I remember I applied, and my intention for applying is like, I'm going to apply. They're going to reject me, and then I'm going to ask them for feedback so I can take said feedback and apply it. Should I not get into any of these schools? And I was sitting in a class in Wayne State. This is right before COVID. And I got this email from UNC that I got in, and I just was like,
Oh my
yeah, I
God.
just couldn't believe. I thought I was so certain it was a mistake that I accepted it
What?
so quickly, and I moved as fast as I could because I
Oh
was like,
my
there's no way. I have a GED, I have felonies, like I have these massive gaps, like I don't know. I couldn't believe it. And then UNC was like a huge culture shock for me as well. It was very wealthy, it was very educated. People were really smart, and it was my first time really interacting with the behavioral health needs of the more like affluent community. I like
Okay.
didn't really know that that existed. I really got presented with the job managing the programs at a recovery meeting. They wanted someone who wasn't, they wanted someone in recovery to come do this job. They didn't have anyone. So they approached me about it, and I worked one-on-one with a lot of these students. And I remember thinking like, well, like rich people don't really like have problems. Okay. And then so I met with them and they had so many problems. They had like more, these kids carried more stress and more pressure than like anyone I had ever met because the expectations just weren't the same.
Right.
So, and I met people with like profound mental illness, like profound schizophrenia, who were brilliant, like could speak multiple languages, but I had these co-occurring disorders. And it just really opened me up to kind of the spectrum of all of this. I was also doing some research for an organization while I was doing all that. I was also doing research for the university. So I really had a wide spectrum of kind of looking at this from a larger level. And then I was finishing grad school and I was like, oh, great. Well, I'm gonna find a job. This is also gonna be really hard. It's crazy actually. I really wanted to work in Atlanta on the state level doing opioid stuff. That was like my whole grad school, even before that, my last year, my bachelor's even, I was like, I'm gonna go to Atlanta and this is what I'm gonna do. I don't know why, but that was like that's what I'm gonna do. And so I'm applying for jobs, and I'm just getting constantly rejected. I'm doing so many interviews, getting constantly rejected. And I'm like, well, of course I am. And then finally, my friend, who was getting her PhD at Emory at the time, who I'd gotten sober with, she sent this job posting to me for this DBHDD job, and I applied, I interviewed, and of course, the whole time I'm thinking, I'm like, there is no way they're going to hire a two-time felon for state government. There's just no way. Everyone tells me that I can't get a job here with two felonies. There's absolutely no way. I need to like get this out of my mind. So they emailed me and they started asking me for references, and I had no idea how the process really worked. I had kind of gotten like offered jobs just through knowing people prior. So I had never really done this formal process. And so I didn't know that when someone asks you that, it typically means that they're going to give you a job offer. So they emailed me for my references, and I ignored the email because I was like, this is a waste of my
What?
time and my references' time.
What?
I know. I just had no, I had no, I didn't understand anything. And it wasn't even that long ago. So I ignored the email because I thought it would be a waste of everybody's time. And I was too afraid to ask my references to be references because I knew that they'd follow up with me and ask me if I got this job. And then I'd have to tell them
Oh
no.
yeah.
And I was just too embarrassed. But then they emailed me again and asked me for my references. And I was finally like, okay, whatever. And I sent them, and I was living in North Carolina. I had a week and a half until my lease was going to be up. I had nowhere to go. And so my plan was I was going to get a storage unit in North Carolina and live out of the storage unit in my car until I could find a job.
What? What?
And so I got the call, and then I had a week and a half, and I was like, okay, I guess I'm moving to Atlanta. And I packed up all my stuff, and it was another one of those things where I was like, I need to get there before they retract. So I was here within a week and a half, and like ever since, I don't know. I have this job. I've gotten promotions. Like I chair a subcommittee on policy for this stuff. Like I'm on a board. I really, if I talk about it too much, I'm gonna start crying. I just like I can't believe my parents, I can't believe it. Even when I got into UNC, I had people from my hometown being like, you mean like the online school, right? And I was like, no, like I really so yeah, every day I'm just like, wow, like I can't believe. Sometimes I'll go like walk around Atlanta or like go on a run, and I'm just like, I cannot believe this is my life. I can't believe it. So I'm just very grateful every day.
That is so amazing. It's it's the quintessential story of, a second chance
Yes, that's how I feel.
and this kind of rags to riches type of story of coming from such a painful place to being where you are now. I really appreciate you sharing with me. Um, there was for whatever reason, one thing that really stood out to me was your interaction with that attorney when he said,
Yeah.
you could be where I am, and how you received that. You received that almost like as inspiration, right? Like,
Oh yeah, and he was mad.
because it's funny because when you were saying that in my mind, I'm thinking of like his kind of him implying that like you can control it if you would just stop. But that's not how you interpreted it. You
Not at
interpret
all.
I
Not at
and
all.
isn't that and that's amazing because it sounds like it was pivotal for you.
It
Like
really was. It
it
really was.
it did it planted some kind of seed for you that ultimately you began to believe that. Is that a fair?
No, that's 100% fair. It's something I think about all the time, him saying that, especially him saying it in the way that he said it. I think in recovery or pre-recovery and maybe very early recovery, you have a lot of people who come in and they're like, you can do it. Your life's gonna be great, blah, blah, blah. You can do it whatever you want. But it's very rare that you have this like multi-million dollar network lawyer being like, you literally could do exactly what I'm doing. You could be in this chair if you really wanted to. Just the way I was like, I know he means this. Like, I know he's not saying this to gas me up right now. I know he sees the fact that like I have this potential that I'm
Yes.
just wasting. And
Yes.
I just had never had someone say that to me in that way. And then like I kept getting little snippets of that, like in community college. And I took a philosophy class, and one of my professors was like, you could get into whatever grad school you wanted. And I was just like, Like, I don't know. It was really mind blowing for me. I thought all this stuff was so unattainable.
So you had a number of instances like that where you saw yourself in a particular light, it's a negative light, as
Hmm.
so many of us do, particularly in active addiction, but even into recovery, it's like low self-worth, right? And shame and guilt. And but UNC saw something in you, right? DBHDD saw something in you. This attorney saw something in you. What do you think they saw? And do you see it now?
I think I'm getting better at seeing it. I know I'm a good talker and I can be kind of funny. So I don't I don't know. I guess I do. I mean, I don't really know. I have so many instances where I'm like doing my job and I'm like, okay, I can do this. I actually think I'm doing this well. I think I'm doing okay. I don't think I'm gonna get fired. I think it might actually take a lot for me to get fired. I I have those little moments where I'm like, I think I'm okay. But then I have other moments where I'm like, my life's not perfect either. I'm like in crippling debt. I'm still dealing with the repercussions of like some of the things my dad has done to me financially. So it's not perfect. So I have a lot of those moments where I'm like, why did I do any of this? Why did I go to grad school? Like my life is still feels so hard because I think that's important to touch on too. Like sobriety doesn't cure your problems necessarily. Life still exists and you still have to get through things sober without using drugs and alcohol. Um, but I also have these moments where I'm like, I guess maybe I am worth all of this. I don't know. It's a lot. It's a lot. I feel a little bit constantly torn between that identity and my current identity. So I have moments, if that's a sufficient answer. I don't know if I've internalized that completely. There is still part of me that kind of feels like I'm like manipulating everyone into believing that I'm better than I am. I don't know if
Wow.
that will ever go away.
Right. Or if it maybe has some kind of benefit, if there's some utility in that,
Oh, interesting.
in that it pushes you to continue to strive to be, uh, to grow and excel. That's how I think of shame. Shame gets a really bad reputation, as it should. But I think we all, as human, like as a therapist, one of the things that I try to identify in people is core beliefs. And after working with hundreds and hundreds of people, I started to notice that everybody had this belief that I'm not good enough. Like it is so ubiquitous to the human experience. I mean, people that aren't anywhere near substance use, people that are just, living life, like that's, I think, something that we can all identify with. And why would we all have that if there isn't some reason for having it? And I think if it's used in a helpful way, it pushes us to grow, but it can become devastating. But I want to share this with you. So I've known you for 34 minutes,
Mhm.
right? And I will disclose to you that before meeting with you, I was intimidated by
Oh,
you.
really?
Yeah, well, you have this.
Tattoos.
No, you're an Emmy winner. You sit on these boards and you have this great position at DBHDD, and it's like, wow, this is an important person. And
Oh,
and sitting down and talking with you, um, you have a humility about you that is attractive. I
oh,
think
good.
people. I know for me, like humility is a quality that I am so drawn to. Like, you know what I'm saying? People that are genuinely humble.
Yeah, no, that's so interesting. Because as you were talking about all of this, I was like, I think everything that I have been through, it gives me a pretty consistent level of humility. But I also know that it can all be taken away.
Hmm.
I don't know. I never want to get so comfortable that I don't ever have that level of humility either. Sometimes the anxiety that I have, I'm like, I really hope this never goes away because I'm constantly kind of like striving to be better and to learn. Like I feel like there's so much to learn. And I wish I could just like, I wish I could do the kind of this and like sit down with people and just learn their trajectories and like how you got here and like what obstacles did you go through while you were going and how did you overcome that? Like, I don't know. I'm just so inspired by people. Like, I mean, like commissioner even, he to me is like, how are you doing like how are you doing all of this? And you've gotten all these awards and all these people know you and you're so level-headed and your daughters are amazing and like I don't know. I don't know. Yeah, the humility thing I think is essential.
It is, and you have it. You have a way about you that is approachable and humble, and I think that's a wonderful quality to have. I mean, people
Oh,
who,
thanks.
you know what I'm saying? I mean, you think of the opposite. Those are the most off-putting people, arrogant, and it's just like, oh man, I can't stand those kind of people, you know?
And it will only take you so far. I mean, you may get really far in your career, but I think the older I get, the more I'm learning that that's just not everything. I think for a while, my career was like, if I can amass success there, that's everything.
Yeah. And it's always you get to the mountaintop and then I'm looking at what's next.
Mm-hmm.
It's hard
Oh,
to,
yes.
you know.
Yes.
What so
Yes.
what can you identify, like, so you've been sober, you said almost 10 years.
Mm-hmm.
So at the point at which you got sober, what was it? Like, what can you identify a thing or maybe multiple things that kind of helped you receive the message of recovery, or is it, looking back, is it hard to say?
No, it's not hard to say. So when I was in California, I did have periods of recovery where I was really into the meeting. I would go to AA is kind of the predominant way I initially got sober. It just worked for me, whatever. Um, I was really, really in it and I was really involved. I still didn't have any friends. People still hated me, but I was sober and I was doing the work. And then I relapsed. And again, I hope this time doesn't make you uncomfortable, but like the sex work thing really, really brought me to my knees. I hated it. I hated doing it. Hated who I was doing it. I was disgusted with myself. And I just remember I was supposed to go meet with someone and having this just very keen, like, you know, I had a period of time where like I was completely sober. I was doing this work. I didn't have a single friend in the world. And I was still so much happier than I am right now. And I just I don't want to do this anymore. I don't want to do this anymore with my body. I don't want to do this anymore with my mind. Like
Hmm.
my entire use at that point was I lived in my car. I would just sit in my car. I'd meet somebody in the morning. I'd sit in my car or walk around a park. I'd meet somebody at night, and that was my entire day, every single day. Like there was no fun, there was no
Hmm.
friends, there was no people I was using with, there was no like adventures. It can be like that in the beginning. Like there is periods of romanticism, sure, but towards the end, it was so monotonous and it was so just like I just felt like every time it was just eating my soul alive, and I felt like I was
Hmm.
becoming this. I was so angry. I was so angry, and I was so angry my first year of recovery, really. But I'll never forget that day. It was like the day actually before my birthday. Not that at that point in my life, my birthday was irrelevant. Like days were just days, but I remember I went to go see my mom and I just wanted to like be in her house and I was sitting there and she was just kind of like, well, what do you want? Like, what's up? Like, what are you doing here? And I was just like, I just really need help. And I just started sobbing. And that was the first there's a few things that happened before that. Kept having a lot of these weird little like God moments as well. Um, like I was in Arizona for a while. I was on the run, or I thought I was on the run. I was also doing a lot of meth, so I was really paranoid. And I don't know that anyone was actually like looking for me. But so I ended up in Arizona and I was really dope sick. And I don't know if you know anything about that experience. Like you usually can't sleep, blah, blah, blah. And I hadn't slept in like maybe a day or two, and I was just praying to God, like to help me. And I fell asleep for a few hours. And that's just like something that doesn't really happen. And then when I was back in Ohio, I hit a median in my car and I popped my tire. And I didn't know what I was gonna do. Like I didn't have any money. And this guy came out and like helped me fix this tire because I had a dolly and blah blah blah. And he started just very randomly like talking to me about God and how like God saved his life. And I was like,
What?
okay, I gotta go. And I don't know, I had never before that time like asked for help. I had been to rehab a number of times, but I'd always kind of been through some sort of legal intervention. And I remember just like I so sick and tired of doing this and just praying for something to happen. Like I was so used to getting arrested. So I was like praying that maybe I'd get arrested and I'd get sentenced back to treatment. But I just drove to my mom's house and for the first time in my life, I was just like, please help me. And I never had the strength to like to say that to someone before, like, will you just please help me? Um, so I don't know. I feel like there was a few things kind of leading up to it, but like it was really just like the immense pain and misery
Mm.
and I really think this is something that is just not talked about that often in substance abuse, but like sex work really brought me to my knees. That experience, it was debilitating for me as someone who was doing it out of desperation. Um, and I don't know. I think that plus a combination of a number of other things. I just, for the first time in my life, just begged for help.
Talking about pain and as you share, like I can see you walking in that park and just the life you described, and I can identify with that, not in the circumstance, but what that feels like. And yeah, it's hard to describe it. And you know, to look at you now, it's like, wow, how in the world did it's such a juxtaposition, right? It's so different, but
It's so different.
it's so different. But for me, like that person is still there. I don't know if you feel that way. Like that person isn't really gone. He's there, and sometimes he comes out and he says, "Hey, psst, hey." Do you feel like that sometimes?
No, I do feel like that sometimes, especially like finding yourself in other kind of emotional misery in your life, like bad relationships, bad jobs, like that kind of that desperate person comes out for sure. And I feel like I felt some of that kind of just like I can't do this anymore through different
Mhm.
experiences in my life as a sober person. That has brought me to my knees. And but I think kind of this grand change in that beginning really helps me to be solution oriented in those situations. I think it takes me time. Like I still might stay in a bad relationship for even a year too long, but I think that I have a level of accountability in my life now that I can say, okay, I need to make this change. So I think that person exists, but there's also this like new person who comes in and is like, okay, well, what's your part? How do you change this? Like what are the steps? So I always feel like I'm nurturing that like little girl who, like didn't have any friends and like just wanted to fit in. Like I still feel like that a lot, especially just living here like the past 4 years. Like I find myself constantly being like, do you think this person would be my friend? Like I don't know. I feel like I get glimpses of her in so many different life settings.
Do you see that as an asset or a liability or neutral?
I guess all the above. I don't know. That period of time, that 2 years made me really comfortable in isolation. And sometimes I can find myself back in that place. And then it'll be one day I wake up and I'm like, wow, I am just working and going to bed. Um, I think those like, those obsessive behaviors too. Even in my career of like I have to be the best and or I have to get this and this obsession with things that's very secular and it can be things that are relatively healthy like diet and exercise. That's always at baseline been an issue for me. I can get hyper obsessed with my weight. And I see that a lot in those kind of facets of my life. Weight and eating in particular, I find myself kind of back in those and it's easy to validate because it's generally in the name of health. I'm not too skinny or any of those things, but it ends up coming down to like, do I feel in control of this? If I go one day where I do eat outside of like my boundaries, like, am I going to have a breakdown or am I going to be able to be like, Taylor, it's okay? So I don't know. There's so many different nooks and crannies of my life where like that is still such a prevalent idea.
Yeah. Oh, yeah. Yeah, absolutely. I like to think of the idea of we have different parts of ourself, right? You alluded to that,
Yes.
the little girl, right? And these different parts up on the stage. And AA talks about that we want to be the
Yes.
director of the show, and the show
Yes.
could be ourself.
And
Uh,
that's taken me a long time to kind of tease out because I think for the longest time, especially post that what I experienced at that treatment center, I really put people in kind of groups of like good and bad.
mhm.
And it took me a really long time. My first like 6 years of sobriety, I was really rigid. Like I didn't do anything that could be that would be interpreted as like bad. Like
Yeah,
nothing. I was very straight in there. I would never, I don't even know how, I don't even think I was engaged. Just nothing, nothing. I would do nothing bad. I was very rigid and I was so afraid of doing anything bad because I thought if I did anything bad, I could relapse. And I don't even know what bad means, like what the definition of is in this context, but I was really afraid of that. And the older I've gotten, the more I've had to kind of accept that like most people do have good and bad. And I see that a lot in my work, like we work with all these organizations who sometimes they aren't billing properly, right? And they're doing things that maybe seem questionable, but that organization can still be helping people.
sure.
And like I've seen it in so many ways where I've really had to accept and internalize this concept that people really are multifaceted, and so am I. So like there are parts of me that are imperfect and probably not that I should show in public and that needs still a lot of help. I do still have a lot of like rage and anger is something I'm starting to realize as well. And that's okay. It does like there's no one is any one thing, I guess. And I feel like I've just kind of wrapped my head around that.
Yeah, yeah, I don't know. In my experience, it's always changing and evolving. And you know how, like, if you ever had somebody say something to you, and to them it probably wasn't even a big deal. They probably don't remember it, but the way they said it, like, just changed the way that you look at things. Does that ever happen to you?
Are we speaking just in generally or for the worse or for the better?
I'm thinking about in general, but specifically like in recovery. Like I think about the getting a new perspective on things and thinking about things differently. You know, you were
Oh, interesting.
and
Yes.
and
Sorry.
yeah, and I'll hear people say something and I'll be like, gosh, I never thought of it that way. It just never occurred to me. And then it changes everything. I had a therapist. I remember I was dealing with guilt around thoughts of wanting to drink or thoughts of wanting to
Mhm.
use, right? And like, oh God, I shouldn't be having these. Like this means I'm doing something wrong, or I'm gonna relapse or what have you. And I remember my therapist being like, it's the most normal thing in the world for an alcoholic to think about alcohol. Like it's okay. It's
Right.
you can't control the thoughts that pop in your head. And like she gave me the freedom to have those thoughts from time to time. And now, because of that thought, like when they show up, I have a totally different relationship to them. It's almost like I can smile and oh wow, there that is, instead of being like, oh shit, this is bad. Like, does that make sense?
Oh yeah, there's so many instances. I remember once I was at a rehab where you had to find people to drive you to outside AA meetings because they wanted you to get integrated into the community. And I was driving in the car with this woman and I was talking to her about like my life at that point had just been so cyclical. Like I would get arrested, I'd go to treatment, I'd come back out, I'd generally relapse like immediately and I'd start over the process. And I did it for a long time. And I remember telling her that, and I was just like, I just don't know, like, how long this is gonna last. Like, I don't know when I'll be back in jail. And she was just kind of like, you don't have to like ever do that again. And I was like, I don't know. I'd clearly heard that before through like various meetings, but like it just never clicked to me that like this cycle that I was living in, like I could stop it. Like I don't actually have, like I don't have to relapse after this. Like I could stay sober. Another, I don't know why, when you were talking about the therapist, I struggle with being a horrible judgmental person. I get horribly judgmental, and I think that has subsided since I've gotten sober. But I would used to go to this meeting, and this young girl would always bring her baby, and she would just kind of like let the baby go and like walk around. And for whatever reason, younger Taylor was like so annoyed by this and like thought it was so inappropriate. Like, can't you keep your kid with you while you're at a meeting? And I remember telling my therapist, complaining this to my therapist, and she was like, "Well, why don't you go over to that baby and like pick it up then?
Hmm.
If you see her with the kid there and the kid's running around, why don't you go pick up the baby and like help her?"
Hmm.
And I just like, I have never, I have so much judgment of people and like how they engage in the world and like what they're doing and how it affects me and what I'm interpreting it as, that sometimes I forget that like this is a young woman, young single woman in early sobriety who also has a baby.
Yeah.
And she's trying to navigate all those things. And instead of being like, I'm so glad this person is coming despite having to take care of this newborn, I'm so glad that she's at that meeting. I was harboring all this judgment when I could have just got up and helped her. I'll never ever forget that. I think of that all the time. All the time. Whenever I'm being really judgmental towards someone, I'm like, well, maybe they're going through something and I could help in some regard. I can be very harsh sometimes, especially when it comes to work. My expectations can be very high of others. And it's helped me to kind of be like, well, wait, maybe this person's like going through something. Maybe I could pick up where they're leaving off, and like maybe I could help kind of mend this all together. I'm going to go through something hard, and I hope someone would do that for me. So yeah, I don't know if that's a good answer to your question. It was kind of two different things. But when you were saying that about your therapist and her being like, yeah, that's so normal, I was like, oh wow, I have some therapist moments that have definitely changed my trajectory.
Therapists are like that.
Oh, she was incredible. Yes.
Yeah. Yeah. Well, the good ones hopefully are like that, I should say. Yeah.
Mhm.
Wow. I ask everyone about because we work with uh, future healthcare workers,
Oh,
right?
cool. Awesome.
Nurses, doctors, social workers, counselors, public health. We work a lot with the public health students at
Hmm.
Emory. And if you, as someone who has been through addiction, and I'm sure throughout your experience, come into contact with a lot of healthcare workers and had
Hmm.
some experiences, what would you say to them as far as what would be meaningful or what would be important or what would you like them to know as they enter into this workforce and are going to see people with substance use disorders?
Hmm. That is such an interesting question. I actually just met with someone who's working in EIS at the CDC, and it's her first time really working with substance use individuals. Um, so when you're asking, and it was just an interesting conversation because she had never really been exposed to that, and she was kind of like figuring out how to navigate it and X, Y, and Z. So when you're asking this question, are you asking like how to engage with that population? Sorry if I'm not remembering it
Yeah,
correctly.
yeah, absolutely. I think what comes to my mind is we talk a lot about stigma,
Hmm.
and breaking down the stigma. And I think uh, perhaps something that so I'll tell you a brief story. So I had an experience, and this really wasn't related to addiction. I was having some sleep problems, and I was seeing this sleep doctor, and he'd never met me before, and he walked in the room. He went right to the computer, he didn't say a word to me. He went right to the computer and he started typing on his computer. And I'm just sitting there, right? And this guy's just going away on his computer. And then he turns around and he's like, "You have sleep apnea. I'm going to put you on a CPAP machine."
Mm.
And which I was on for a year and actually didn't have sleep apnea. And
Mm.
so, you know, have you had experiences like that as far as working, being with healthcare workers? And is there something that you would want to say to them, like, hey, maybe this is something that you could do differently, or hey, maybe spending more time with them, or being kind to them?
Oh, it's a really interesting question. So I'll first speak from like the public health kind of government program perspective, because this is something that I do see. You know, we manage these programs at a very high level. We give them the money, we make sure they're doing the reporting. We're not really engaging with the day-to-day kind of the grassroots thing going on. And, you know, I see people who will get really frustrated with these programs or these organizations. And I think sometimes you forget that there are people at the end of these programs. There are people's lives and integrity, and I mean, their entire futures at the end of these
Mm,
programs. And to try and remember that those are the reason that you're doing this. Those are the reason that you have a job is because of the people at the end of these programs. And when you're engaging with them, remembering that like this person who's maybe submitting this payment request that's not entirely perfect may also be leading groups and dealing with client issues and you know what I mean, and dealing with the whole gamut of the things that really make these wheels turn.
right.
So I always try, because I even see this sometimes in the current job that I'm in, is remember that there are people's lives at the end of these programs.
Mm,
Um, More generally, I feel like sometimes people with substance use disorder are treated as if they are incapable. Not, and I don't necessarily mean that in like, oh, this drug addict could never do anything, but I mean, coddled's not necessarily the right word, but these are people just like you and I, obviously. They're capable, they can be accountable. They are just people who have fallen into a dependence. And generally that dependence is because of trauma, is because of a co-occurring mental illness, is because of lack of community and lack of feeling connected to anyone or anything, our core coping mechanisms. And if you generally kind of focus on those, the real issue, those people can do anything,
mm,
right? Like they're obsessive, they're hard workers. I mean, they're just like anyone else. I don't know. I think that there can sometimes be this perception that they are beneath and they're
mm,
incapable and we need to come and we need to save them because they can't do it for themselves. And yes, like addiction is not a choice. But these people are capable of full lives.
mm,
I don't know if that makes a lot of sense. I think sometimes with like some political movements, uh, in the name of good, we put people into these buckets that they can't defend themselves, and we have to come and do it for them because they're not smart enough, and we have to talk about this for them because they don't get it and they're not smart enough, and they're spoken of as if, and it's with good intention, but they're spoken of as if they're not within the population that you live in.
right.
You know, these are the elderly women who have been overprescribed pills who have no idea that they're addicted. These are the frat people who are drinking too much in their fraternity and they they want to drink less or they didn't intend to drink that day, but they did it anyways. They're fully capable, and really a lot of them need the platform to reach the same areas that we are. They don't necessarily need someone to come in and do it for them. I don't know if that makes a lot of sense.
Well, it sounds like, I mean, a big theme is that, these people have value and worth, and
Hmm.
and that they're not bad, or I mean, it's and I think unfortunately people aren't treated that way,
Hmm.
and we see it all the time where they're treated like trash so often. And that's what's so powerful about the attorney, because the attorney that spoke to you, he was showing you the opposite of that. He was saying, no, you have tremendous potential and worth, right? And it was, and that was, gosh, what an effect that had on you.
And I think the biggest thing is he spoke to me like someone would speak to a frustrated equal. He didn't talk to me like I was a little kid who didn't understand what was happening to me and you can't get yourself out of this. Like I got to come help you. He spoke to me like a fully capable adult who could get myself, but who, with given the right resources, could get out of this situation. I think sometimes that we with the best of intentions, right? We see these people as othered and it's like, oh, we have to come in and we have to help them and they don't understand, they don't have the words, they don't know how to get out of this on their own, and these people are fully capable. I think sometimes, especially in these public health realms, we talk about like these populations or that demographic, and it kind of like almost marginalizes people that don't necessarily need to be.
Right.
And I want to remember that like these people are really just need a platform. They don't need someone to come in and tell them what to do and plan interventions for them that doesn't get what they've ever been through. They know what a lot of times they do know what they need. They're fully capable. They understand what they're going through. Sometimes there are some co-occurring things that can happen where maybe that's not as prevalent. Um, but I think sometimes in public health we almost dehumanize these populations and these demographics and all of these statistics that we talk about, and just remembering that like this is everybody in some capacity, and it might not even necessarily be a drug. It's the person who's overly obsessed with their weight and working out, or the person who whenever they're sad they eat way too much and gain weight that they don't want to eat, or the person who's so entrenched with work validation that they've given up their personal life because they're so deep in it. Addiction can look a lot of ways. It's not just drugs, and it affects us all very differently. And I think just remembering that these aren't just like some poor, sad, lowly demographic that you have to come in and intervene on and help. Like these are people with power if given the right tools. So give them the tools. Don't try and come and take up the space for them as if they're some sort of adolescent who can't speak and advocate. I don't know. I've experienced that.
Oh, yeah, absolutely. I think, unfortunately, that's a norm. You know,
Hmm.
that stereotype of people. And I had a doctor that I worked with who said he believed he was going to write a book called "Addiction is a Superpower," and I love that. And that has been really true in my life as far as being in recovery. I truly view my addiction as an asset. I truly view it as an asset, not a liability. Now, there was a time where it was very much a liability, but I think in recovery we have the opportunity to turn it into a superpower. Like really,
Hmm.
really and truly.
I know.
Um,
Yeah, I agree. I do think for me, at least, especially maybe you're farther along than me, that it's a fine line.
yeah.
I'm thinking of like, I get very obsessed with running and I'll run for a really long time. And if I were to tell you, oh, I ran 10 miles today, you'd be like, oh, that sounds remarkable. But my feet are falling apart. I have no
Yeah.
toenails. You know what? And it's like, but I'm obsessed. And like,
Yeah.
if I feel like if I don't run to that increment level, then I didn't really do anything, even if it's like 9.5 miles. Even with work, it's like I have to have the biggest, grandest title. I have to make the most money, and I can get very obsessed with that, and it can come across to people as a superpower because look at all the things you're doing and all the things that you've accumulated. But sometimes, in that same token, it can be debilitating.
Absolutely. Yeah, it can go both ways.
Hmm.
Absolutely it can. Well, I have one more question for you, and I really thank you for taking the time to. We could talk about this
Oh
all
yeah,
day,
this
I'm
has been
sure.
so interesting.
It's so interesting. So I don't have any tattoos.
Oh,
I
okay.
I am seriously considering getting one, and
Ugh, don't do it.
don't do it. What? Well, okay, so let me ask you this. So I've been thinking about getting one, and it's a big decision, right? Like this is something that's going to be on me for the rest of my life. And in doing so, I would imagine that if you were to do that, it has to have some kind of meaning, some kind of story, some kind of value. And so I wonder if there is a tattoo that you have that's particularly meaningful or tells an important story. Or is that not how you looked at it?
Honestly, no. So I none of them had any story or any sort of meaning. I tried to veer away from that. When I was younger, I had this idea that I really wanted to get, and it's so corny to even talk about now. I had this idea that I wanted to get like a witch burning at the stake tattooed on me because I felt like that's how I was when I came forward about being sexually assaulted in treatment. And I remember talking to my sponsor about it, and she was like this very heavily tattooed person, like that you from neck down, like no, just normal skin. And I thought she would be super in support of it. And she told me, she was like, over time, meanings of things are going to change for
Oh,
you.
wow.
Yeah, I know. I was like,
Wow.
okay. And like, you may not always want to be reminded of the meaning of this for the rest of your life.
Wow.
And I think that's when I decided, well, maybe not decided, but after that, I never really assigned meaning to tattoos anymore. I think it was more of just like I wanted to look cool. If I could go back and do it all over again, I probably wouldn't get any tattoos. But
Really?
yeah, sometimes I think maybe I'd be taken more seriously. I don't know. This is all in my head. I tell people this and they're like, that's ridiculous. But I think maybe I'd be taken more seriously in a more general across the spectrum way if I didn't have any tattoos. Um, I don't know. I don't know. It's fine. It is what it is. I can't get rid of them. But yeah, I mean, I go back and forth. I also think that tattoos have been kind of it's just a normal thing now. It's almost more radical when people have none.
Right. Yeah. 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 It's definitely the perception has changed. Yeah.
Yes.
Yeah. Well, thank you so much for meeting with me, Taylor. It's been awesome.
Oh my
Uh,
God, it has been such a pleasure. I'm sorry if I didn't give you what you needed.
you gave me everything and more. It's been awesome, and thank you for the work that you're doing. And yeah, if there's ever anything that I can do, let me know. Um,
Oh yeah, same.
yeah.
Are you
Well,
guys
good.
applying again this year?
We are. We have we call it our immersion program, and it's a week-long education program where the students come and spend time at the clinic. Um, so we've it's been I think this is our fourth year. So we had funding from y'all before the abatement.
Oh,
Um,
from DVHD. Cool.
yeah, yeah, yeah. So we're very, very grateful. We had Commissioner Tanner. He was at our clinic. It's been, gosh, probably been 2 years ago. But he seems like a really nice guy.
Oh, he's a great person.
Yeah,
I really think so. I mean,
yeah.
I don't know him like in a any more than professionally, but I think he's a really amazing person. I've gotten the privilege of like talking to his daughters, and they just adore him.
Oh,
And I
really?
feel, yes, and like I feel like someone who you've accomplished so much. If you go into Commissioner Tanner's office, he has like a wall of different trophies that he's gotten
What?
for his work in mental health. It's insane. It's like absolutely insane. And but if you talk and like, he has this massive farm and he has this massive job and he has always working on these other massive projects. And you'd assume someone at that level like would have no time for their family. But he prioritizes it despite all of that. And something about that to me is so much more meaningful than any of the awards I've ever seen on his mantle. I mean, the way his daughter, they don't want to be too far from him and the
Really?
family that he's created. I just, something about that, I guess maybe because I've never had that kind of like strong nuclear family and still don't. I just like really respect men in particular who like value that and will prioritize that above like all this external validation and
Yeah.
income and things of that nature that prioritize these girls and be in their life. And you can tell that he's been in their life. They're so successful, like they're so confident, like they're
Wow.
so well spoken. I just something about that, like the way that his daughters talk about him, the way that they want to stay in Georgia, the way that they have kind of like modeled their careers off things they've seen him do. It's just like that's really cool. Like I just feel like that's so cool. And then on top of that, you're all these other things. But you've managed to prioritize this in a way where like you're still so close with these girls. He has three girls.
Wow.
I
How old are
know.
they?
I don't know their exact ages. I know that one's currently in medical school, one's getting her degree in marketing. I think maybe she's a sophomore or junior, and then one's still in high school.
Okay, so they're older. I'm envisioning like
Mhm.
little
Oh
kids.
no, no,
No,
no.
these are adults. Wow. It says a lot about a person. I mean, really.
I think so.
Yeah.
I think so.
Yeah, absolutely. Well, good
Hmm.
deal. Well, hey, I hope you have a great rest of your week.
Yeah, me too. Let me know if you need anything.
Thank you. And if I get a tattoo, I'll let you know.
Okay, don't do it.
Bye. Thanks.
Bye.